Okay, so for our third and final case study, it's about RB. He was 3 years old at the start of intervention, lives with his parents and 2 younger brothers now, diagnosed with ASD after our second round of intervention, between the second and third. So we did 3 different rounds of intervention with him. Round 1 focused on the first introductory level of opening his mouth and accepting purees of foods from his mother. So as he was struggling to accept new foods, he was only accepting breast milk, only drinking Pediasure and milk from a cup. He wasn't taking anything off a spoon. Round 2, we did a few months later after he was accepting those puree foods without incident, and he started to gain a little bit of weight, and he was expanding the types and flavors he was eating. So a few months later, we did a chewing intervention to focus on the oral motor skills necessary to break down table foods. And then about a year or so later, Mom contacted us to do another intervention to expand his diet and increase his speed at which he was eating. So once he had developed the oral motor skills necessary for chewing, his mother noticed that he was becoming increasingly more selective in taste and textures of foods. So fruits and vegetables, with a few exceptions, were quite challenging for him. And when he was presented with them at meal times, he would push them away, leave the table, and that made meals quite stressful for Mom and Dad. He had also started packing the food. So he has really adorable, cute little chubby cheeks that you'll see in a moment. And he was putting all of his food into the side of his cheeks. And since his cheeks were so chubby, they couldn't tell that there was food packed away in there. So as he was getting ready for bed, Mom or Dad would have him in the bathtub, and then poof, all these bites of food would come out in the bathtub. Peas were a specialty. They came out whole and untouched. It was like they hadn't been sitting in there for hours at a time at all. So obviously this packing behavior is quite a concern because it can lead to choking. He's not actually experiencing the food. That's more of a clinical issue about it, but it is quite a concern if he's holding it for that amount of time in his mouth without swallowing. But in the next video, or the first video for our RB, you'll see some baseline video of him. So in this video, I'm trying to gain some momentum. Right now he's not accepting anything off a spoon, so I'm using a little oral motor tool called the ProPrefer, and I'm teaching him how to open his mouth more and more each time we do it. So I'm shaping how to open his mouth when presented with something that kind of looks like a spoon. What's that sound? What's that sound? Okay, Remy, we're gonna open. Good job, nice work, woohoo! That was number 2. So in that video, I just got behind his teeth, which was a big step because he'd go like, keep his teeth tucked together and his lips way back. So getting behind those teeth was tricky, but in that video, he showed it very well. He did it with ease. So in the next video, you can see he's a little bit older, a little bit wiser. This is our second intervention of doing chewing. So in this video, it starts off with a big scoop of puree, which you'll see he opens for no problem. And then we start to do molar placement. So I put a piece of Mum Mum, a chewable or meltable solid. It's a little baby food, and I cut it into a strip and put it right on his teeth. And the expectation is that he chews up and down 10 times before taking a little sip of water to help him swallow all the little pieces. Nice work, Remy. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Drink. Nice work. Great. So I have my little tool there ready in case the food falls off of his teeth and I need to push it back on, because at this point he's just mastering the up and down motion with food on his molars. In the next video, the expectation is we start on one side of the mouth and he moves the food to the other side of his mouth and continues to chew. So we call that tongue lateralization. So I give him some time to practice this on his own. I want him to be able to move it around. And then when it comes out of his mouth and onto his lip and he isn't quite able to get it back in, I prompt him, put it back on his teeth, and he continues to chew the food and uses a scoop of puree as a chaser to swallow all the pieces. Okay, 3, 2, 1, choo choo. Here we go. Open wide. Nice. Keep going, keep going. What, do this? Good. Nice job. Keep it in, keep it in. Good. Grab it again. Nice try. There you go. 1, 2, 3. Now you're playing with it. Keep chewing. Keep chewing, Remy. 1, 2, 3, 4, 5. Good job. Nice work. And now for this video, you can see, again, a little bit older, a little bit wiser. This is my observation after Mom called about a year or so after that last video was shown. We're doing some yam during our baseline. So yam was one he had previously been eating but is no longer accepting. And this is how it went.
Yes, baby.
Okay, let's give it another kiss. And then we'll play the video.
You can do it.
What's this?
Oh,
We got a boulder! So, shame on me for not using more strategies, but it was meant for a baseline. After that refusal, I brought out some of his preferred treats that he could choose from. I did a string of behavior momentum to explore the yam, and he came back and decided he was going to follow through with some of those requests. We'll do a couple things with the yam. We're going to touch it with our finger. Can I draw a finger? Whoa, look at her finger. We're going to smell it. We're going to use our lips to kiss it. And we're going to use our tongue to lick it. And then we can get a candy.
that sounds easy peasy.
Yeah. So we'll start with touch. Can you give it a little touch? Whoop, not yet. Not yet. So close. Can you touch it? Whoop. Yes. Good job.
Nice.
And then we're going to smell it. Do you want to put your nose down and smell it? Like this? Use your little nose. Or do you want me to hold it? Hold it. Wow! No way! Okay, now we're going to give it the little smooch. I can't kiss it. It needs a little kiss. Whoa!
Whoa, crash.
It was so excited. Last one is a little lick, and then Remy gets a candy.
Remy gets that
He gets the
delicious candy.
Here, I'm going to put this one on a fork. There we go. You just give it a little lick with your tongue. Very close. Wow, you did it! That was amazing. So as you could see in that video, by the final expectation was to lick, and he started to turn away in his seat, lean away, and then reminded him that, oh, we get that candy right after we're done that. And then, boop, he comes right back up and does the lick. The first time, not quite close enough to his tongue. Barely touched it, if he touched it at all. So then we really wanted to swipe it across his tongue so we got some flavor. This is yam during intervention. So by this point, we have all of our strategies in place. We have choice of reinforcer, we have our chaser bite, we have a bite of target food, the yam, and then because of his history with packing, he had started packing at this point with us as well. We needed to check his mouth after every bite. So you'll see Ivana using a tiny little flashlight, which he actually enjoyed, and we found a couple different flashlights of different colors. That was kind of motivating in the moment to get him to open and show us that the food was actually out of his mouth.
No more super intense bonding quick fixes.
2, 1, last bite of yam. Are we going to put a goldfish or a candy in the treat bowl?
Goldfish, okay. Ooh, a big one. A big goldfish. Okay, we have yam and pepper. Can you do yam first? Nice. Nice chewing. Is the yam getting mushy and small? Good. You're using your teeth and chewing. And cracker. Okay, nice work. Hold on. I have to check inside. Can you show me when it's all gone? And get your goldfish. Is it all gone? Almost. Yay! Nice work. You got the rules
The
quickly.
rest of the day off. My brother.
So this was our first presentation of Blueberry, which has always been tough for him in the past. Talking about blueberries before, you never know if they're going to be sweet or sour. This was particularly difficult for him, not knowing if it was going to be sweet or sour. So for this particular video, he has a choice of either touching the blueberry for iPad or taking a small bite of the blueberry for iPad and a gummy. In this video, he chooses to touch.
2, 1. Okay, my friend, are we going to touch the blueberry for iPad, or are we going to take a teeny tiny bite for gummy and iPad? Touch. Nice work. Eating for gummy.
All right, and at the end of that video, he turned to me and asked for a gummy. He said he wanted his candy. So we were pretty sure the next presentation, he was going to choose to take a bite so he could get his gummy and his iPad. And sure enough, for the next bite, he did choose to take a bite. So his options now, since he had touched the blueberry, he could either smell the blueberry for iPad or eat a piece of the blueberry for iPad and gummy.
So, okay, my friend, are we going to smell the blueberry for iPad, or take a teeny, teeny, tiny bite for gummy and iPad? A bite? Yeah, let's do it. Blueberries. Good work.
And so now we've progressed and we're doing full-size blueberries with chaser bites in between. We're also progressing where we don't look into his mouth after every single bite. So we might look at the end of the 3 bites. Maybe we've determined on his visual schedule where we're going to check it off. And this is what this looks like.
The blueberry. I think it's going to go into Remy's tummy again.
Again?
Again.
Ooh, let's see that. In Remy's
What?
tummy.
Not in your teeth? In your tummy? No way.
You swallow all your bites? Ooh.
Chew, 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 chew. Lots of chews. Keep chewing. Make it smaller. We can't swallow in our tummy if we don't chew. In your tummy again? What? What? Okay. Last one. Is it going to go in your tummy again? Chew, 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 chew. Big chews. Crunch and munch. Crunch and munch. Keep chewing. Oh, sit down, please. You can have yogurt to help you. You don't have to wait. You like to swallow it first. Okay, some water. All in your tummy. 3 berries. Your tummy's gonna turn blue. Can I see? Nothing there?
Wow! Look at that.
This is amazing.
At that point in intervention, we also started realizing that chewing and swallowing the cracker between bites was taking way too long. So we wanted to have a food that he would reliably, immediately swallow. So we used juice and we used yogurt, spoonfuls of yogurt, because right as that spoon would enter his mouth, he'd swallow almost right away. And especially with the blueberry, he was struggling to swallow the pieces of skin. They would get stuck to the sides of his mouth, and it would bug him. He'd be constantly trying to put his fingers in his mouth. And I mean, this is the beginning of the pandemic, so we wanted to keep his fingers out of his mouth. So we used, yogurt or juice. In the next video, you'll see some juice as the chaser. And this is also raspberries. So another presentation of a berry. Berries are quite difficult for him. And as you can see in this one, we've gotten to bigger size bites pretty quick. This is only the second time we're doing raspberries and the bite sizes are pretty big.
With this train, so fun. We're gonna do 2 bites of raspberry. Good job. Ooh.
Ooh, very good.
We're not quite done. Keep chewing. 1, 2, 3, 4, 5. Good chewing. And we'll chew this one. Sorry. Chew this one. 1, 2, 3, 4. 5. Do you want yogurt or juice? Juice? Okay, I'm gonna check after this one too, okay? I'm gonna check. 1, 2, 3. Beautiful. Okay. Let me know when you're ready. There's some water too to help you swallow. Ready. Ready already? Ready already? Beautiful. Nice work. That's great. Big treat.
Have your treat.
Good. Thank you.
All right, so in that video, you saw me use my fingers to check the upper part of his mouth between his lip and his gum line. We were noticing that instead of packing away down here in his little squirrel pocket, he started to put some foods up here and he'd be walking around like this, trying to hide the food. So what we started to do was to scoop it out. And as you can imagine, it was aversive both for him and me. I don't want to be scooping food out of his mouth. He didn't enjoy it. It didn't feel nice. So I would say if we do 10 bites of food, I'm going to do a check at bite number 5 and a bite number 10. Meanwhile, he always has access to his water to try and flush it out himself. He has opportunities with yogurt and juice to try and swallow those pieces as well. And then I just do a really quick check to see if there's anything up there. And eventually we faded that out altogether, which was wonderful. So the plan of intervention for RB, we had a visual schedule. It let him know when the meal time would be over, what foods we would be doing, and in what order. We also let him know if he was going to be smelling, kissing, licking, or eating the food based off of his choice. We had a contingency map for speed and clearing his mouth, so I have a visual of that coming up on the next slide. But basically, midway through our intervention, when we started to get to bigger size bites and those fruits and vegetables, he started to pack them away, squirrel them away in his cheek pocket, and it really slowed down the meal. And having 2 younger brothers and a mom who was, expecting her 3rd child, she was not going to be patient enough to sit there for the duration that it was taking him to chew and swallow. She needed to get him up, get him out the door, and get going, which makes sense. So he really wanted to speed up that meal for her. He was very motivated to earn his preferred foods, so the yogurt, the crackers, and then he was also very motivated by earning little bits of chocolate and cutting up little gummy bears. I think we cut a gummy bear into 8 pieces at one point. He was still just as happy with that because he never, ever, ever got them. So he earned the highest level of reward when he beat his timer. We set a timer out for him, and he would have to chew and swallow the bite within that given timer. And if he was successful, he'd earn the highest level of reinforcement, so iPad and a small edible treat. If he finished his bite just after the timer, he likely just got a little bit of iPad time, so just a fraction of the preferred reward. And if he finished that bite a long time after the timer went, then he wouldn't get a reward at all. We'd just move on and do the next bite. So as we've seen in other case studies, we were earning tokens for completing expectations during the sessions. And so once he had all of his tokens on his board, he could cash that in for a bigger reward at the end of the meal. That could be watching a movie, playing a game, or going to a special park with mom, or it could be like a small gingerbread cookie, or basically a gummy bear that wasn't cut up into 8 pieces. He was just as happy for in the end. So initially after each bite, when he chewed and swallowed quickly, we were using that those edible treats right away. And over time, we were able to fade them out altogether. And so we weren't reinforcing every bite. We thinned the schedule of reinforcements so that he was getting the treat reward at the end of the meal. And food chasers were used to help him chew and swallow the bites. So after he chewed the food a few times, we'd allow him to have a bite of his yogurt or cracker or a sip of juice. We did monitor that juice. As we've talked about before, juice is an appetite killer just like milk. So we only had about a tablespoon or 2 in the cup, and we'd really regulate how many sips he got out of it because he would just slam it back really fast if we let him. And the food chasers, just help facilitate the same behaviors as eating non-novel foods. So making sure that he's chewing and swallowing in a relatively quick manner. So this is the visual contingency map we used with him. So this was helpful. It would remind him that what he was earning right after he followed through with the most desirable response. So initially we did a baseline timer. We'd give him a piece of the food and see how long it took him to eat that food. So I think for blueberry, initially it took 7 minutes for the first blueberry to go down. So our first timer, when we did a speck of food, was like over a minute, like 1.5 minutes to finish a teeny tiny speck of food. And if he beat that timer within the 1.5 minutes, then he got the full amount of reward, the most highly preferred things. Over time, as he became more fluent with the food and as we increased the bite size, that timer would go down from minutes to seconds. So usually about 30 seconds to chew and swallow a bite of food is sufficient, sometimes a little bit longer for foods such as proteins or if there's already an oral motor delay that is of concern. So the second column in the middle, if he finished the food within an extra 15 seconds of the initial set out time, then he could have a fraction of the reward that he was earning, so probably just the iPad, which wasn't as motivating. And then the last section showed him that if he didn't eat his bites in time after both timers went off, his mouth was still full, he would not get the iPad or the gummy, so we just have to try again. So here's a histogram of foods that RB learned about. So just let me make it bigger for myself here. So without puree, foods are not included in this, but this showed foods introduced during the second intervention. The chewing intervention is in this light orange or pinky color. And then foods he was eating pre-intervention and during the feeding intervention. And then foods that are introduced by his parents. So pre-intervention is the green, the dairy, the milk, and the Pediasure that he was eating before the very first round of intervention. And the outcomes for RB. So we had outcomes for our chewing intervention, feeding intervention, and then foods that were introduced by the parents, all separated. The foods that are bolded in that fruit and vegetable section are all foods that he had been consuming during the chewing intervention, the second intervention, but that he had dropped and we subsequently reintroduced in the third intervention. So as you can see, he has at least 3 foods in every food group. 3, the dairy one was the lowest. But other than that, he's got a good variety, lots of different tastes and textures in there. So outcomes for RB, he is now eating over 50 foods from all major food groups. He had 48 intensive treatment sessions with a therapist and 5 hours of parent training. So initially we had 36 sessions set out for this family, but we had some external variables that were in play. So RB got sick right in the middle of our intervention, and that was very difficult. He was really congested. It made it really hard to practice swallowing foods quickly. If he couldn't breathe out of his nose, it was making chewing and swallowing quite difficult. Also, just presenting new foods while you're not feeling well is not going to go well. So we put that on hold for a few days while he got better. Mom was also expecting her third child, so we did most of our training sessions with his home team so that they could support her once the baby was born. And then this is right around Christmas time. So this was about a year ago. It was interrupted with Christmas break. So we had to regain momentum when we returned back to session. So we asked for a couple extra sessions, got him back on track, and then continued with our training, our parent training. So more outcomes for our B. He's now able to chew and swallow a variety of table foods, able to try and eat the same foods as his family members. Before intervention, Mom would have to make him a separate pasta dish at every meal. And now he's able to eat foods that resemble what the rest of the family is eating. So even if he's not eating them all together, he might be eating the same foods, just deconstructed. But from what I hear now, because this was a while ago, he is now able to eat a lot of those foods that are put together again. He's fully participating in his family meals. They're not having to feed him separately from his brothers. And she's been able to introduce a lot of new foods without us being present. So some new foods she's introduced: apples, oranges, grapes, fries, different breads, wraps, pastas, baked goods, fish, beef sandwiches, grilled cheese sandwiches, yam tempura, crackers, granola bars, cookies, desserts, and the list goes on.